Testosterone replacement therapy. Are there dangers? Is it safe? We're going to talk about the potential side effects with TRT after this. So keep watching. Today we're here to discuss, are there side effects to TRT and what are those? So I'm with Dr. George Touliatos, a TRT expert, an author of 2 books, a former competitive bodybuilder who's come all the way from Athens to be with us at the Balance My Hormones booth in Birmingham at the NEC. So we're going to discuss, are there any dangers or concerns and side effects of TRT. So hi, Dr. George.
Hello, Michael. Good to see you again this year.
Good to see you. So, and this is a question that comes up sometimes to a new patient who's looking to start TRT. They say, well, I wouldn't mind doing TRT, but my GP told me that it may be detrimental to my health.
Well, any medication has potential side effects. The point is that TRT equals optimization and balance of hormones. So, yes, we may assume that if TRT is not used properly and wisely, then, and if it's abused, then it may have some side effects like erythrocytosis, because androgens and testosterone in particular treat anemia. So if you step to the other side, you're going to have increased red blood cells and hemoglobin, that increase viscosity. Now, if you don't control excessive estrogen production, you're going to have aromatization and occasionally gynecomastia. Then there is also the prostatic enlargement, but to a benign form, which is benign prostatic hyperplasia, has nothing to do with a malignant prostatic cancer. So these are the standard deviations that come out of improper use of testosterone. If it's widely used with a certain protocol, then it's all good.
Okay, so those are kind of the most common side effects. I mean, there's smaller side effects would be like acne. There would be like, some people may be more prone to acne, but not everyone gets acne.
Yeah, acne and hair thinning are aesthetical parts of the side effects. Now, acne is DHT related. You can control acne with certain creams, UV radiation, hygiene methods, but also occasionally the 5-A reductase inhibitors that control DHT may help with that. And hair thinning is also DHT related, but those who are prone to this, okay, so not all people, including myself, are prone to hair thinning and androgenic alopecia or male pattern baldness, okay?
Yeah, you're very lucky in that regard.
Yeah, but I'm not lucky in the terms of erythrocytosis, so everybody has his weakness.
So, and I too sometimes will have elevated hematocrit and hemoglobin because I also have sleep apnea, and even though it's treated, it manages things, but I think once the seal's broken, it's never quite the same, and I'm always struggling, it sounds like you, to keep the hematocrit within a narrow range. But that's something we've also talked about on previous videos, that perhaps there's an adaptation mechanism.
Exactly. And yet you can still avoid the spiking of the testosterone into microdosing that will reflect in a less elevation, a rise of the hemoglobin.
Or some studies show a topical testosterone treatment will also mitigate some of the effects of elevated hematocrit and hemoglobin, yeah, as well as the predictor of hematocrit and hemoglobin elevation may be also due to the free testosterone levels on trough. So the higher those levels are on trough, then the more at risk some people may be to having higher hematocrit and hemoglobin.
Yeah, that's why we break down the dose into smaller ones to have more stable levels and avoid the lesser spiking of estradiol and DHT.
So one of the discussions that we've recently had with Dr. Rand McLean, there may be a side effect, but he said, is there ever a side effect that can't be managed? You know, everything has a solution.
I guess that people are abusing testosterone like cycling and blasting. Using 250 of testosterone will certainly have more side effects rather than use 100 milligrams of testosterone. We have to clarify and differentiate between testosterone used for bulking purposes and muscle gains and testosterone use as a replacement therapy for biological need.
That makes sense. Now, one of the other things to consider is what is the risk for a patient who has low levels of testosterone? What are the side effects of that? Because there were some papers and studies that have come out that showed an increase in mortality with men suffering from low levels of testosterone.
Exactly.
We were talking about what are the risks of not having optimal levels of testosterone, okay? Because if your levels of testosterone aren't optimal or they're low, you're at a greater risk of mortality.
Yeah, generally, low testosterone is linked to higher mortality rates. And staying out of testosterone if you're hypogonadal has more risks rather than entering on testosterone. So low testosterone is linked to obesity, muscle wasting, visceral fat accumulation, heart inflammation, osteoporosis, bone fractures, anemia, fatigue, depression, erectile dysfunction, and lack of sex drive, leaving man a miserable human being. And in COVID, low testosterone is linked to death. So most of the victims of COVID in men were of low testosterone.
So I guess just to sum it up, and thanks for watching until the end, that, you know, there are some side effects of testosterone. Those side effects, when you're on treatment, can be managed, and that there's almost a greater risk of going through life with low levels of testosterone without being treated if you need it, than the side effects that you do experience. And I can say this from the heart, because I've been on TRT for 26 years, and you've been on nearly as long, 6-7 years, and I personally feel that the quality of my life is better now than if I had just had low levels for all those years. And, you know, I've talked to some people today at the booth who asked about, you know, being on hormone treatment, whether it's for females and HRT or males for TRT. And yes, there may be a small inconvenience. You've got to do your injection or apply your creams, and you've got to kind of plan for it and make sure you have your stock of medication available so that you don't go without your treatment. But the quality of life, the improvements, the buffering it has compared to when you don't have it, I think is really important.
It's linked to anti-aging, age management in men. You know, it's vitality.
So, and we've talked about on previous videos that, you know, environmental toxins, all these reasons for the low testosterone, you almost need to have this buffer to protect you if you're low. So I'm just really tired of the demonization and the stigmatization.
Demonization and stigma come out of ignorance, but mostly because of the misconception between testosterone and anabolic steroids. Testosterone is an androgen that treats hypogonadism with anabolic properties. This is a fact, okay? Now, bodybuilders abuse this, but TRT optimize the use of testosterone. It's another thing.
Well, that's well said. Well, we'll leave it at there. If you have questions about side effects either you've experienced or that you're concerned about, please leave those in the comments, and we will try to address those. And do consider subscribing to the channel. We're really trying to get the word out to stop the stigmatization of testosterone and other hormones when they have such a useful, important impact on the quality of people's lives. So thanks again for watching. Thanks, Dr. George. We look forward to doing another one. Hi, I'm Mike, the founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to TRT or HRT, you may want to follow the channel